Hi, I'm Dr. Rolando Breier. I'm a medical oncologist here at MCMH. I was born in Buenos Aires, Argentina. I've been in the States for 20 years. I landed in Houston with my family. I took my boards there to revalidate my medical degree from Argentina and landed in New York to do internal medicine and also did a year of pain and palliative care at Sloan Kettering, Memorial Sloan Kettering Cancer Center, which is probably one of the biggest cancer centers in the United States. Because of that, I'm also board certified in hospice and palliative medicine, on top of internal medicine and medical oncology, which I think that really complements well, what I'm trying to achieve here at Montgomery County, which is basically have a comprehensive cancer center. Knew I want to be a doctor when I was like 6 years old. Unfortunately, I come from a big family of doctors. Actually, my sister is a hematology pediatrics. My grandma was a midwife. My dad was also a medical oncologist. My cousin is actually a pediatrician in New York. So it's kind of a disease that runs in the family. And when all my friends were playing with little cars and cards, and I actually was playing with a first aid kit. And I really knew that I wanted to be a doctor. Later on, when I started my medical residency, I found out that there were a group of patients that had cancer, and when that happened, basically they were left alone. Nobody wanted to take care of those patients. The prognosis was abysmal. The patient had cancer. There is not much that we can do. So I understood that these patients needed someone to take care of them, someone who actually wanted to take care of them. And I say, well, that's me. I really want to fight cancer. That's what I tell my patients when I see them here. I don't sell chemotherapy. I don't sell treatments. I fight cancer. I fight cancer every single day. And that's how I see myself. And that's what brought me to treat these, cancer patients. I have two boys, Axel and Ian. They are 17 and 20. Home, I have a house here in Shenandoah, but home is Kansas City. I come here on Monday, Tuesday, Wednesdays, and Thursdays. My son, is a sophomore in high school. Actually, mission is he thinks that he wants to do aerospace engineering. So the oldest one, Axel, is currently at KU Lawrence and doing pre-med. I like to cook. I'm Argentinian, so we like to cook what we call asado, which is basically barbecue, but it's not smoking meat, it's over charcoal. And I have my favorite cut of steak, which is skirt steak, but we eat a lot of more meat. And I'm also, as a hobby, I'm a private pilot. I did my what we call PPL, or private pilot license, and I enjoy flying, and I take my youngest son who wants to be aerospace engineer with me. I told him if you're gonna design planes or drones, you need to know how to fly. It's like I'm gonna be designing cars, but I don't have a driver's license. No, we need to fix that. So he's taking also flying lessons with me. Well, I really like my patients to understand that they have a team. They are no longer alone with their diagnosis. They have a doctor actually wants to help them, a doctor that actually wants to fight their cancer. I understand what is going on, I understand what they're going through, and that I will do the best of my ability to help them going through that, to the treatment, and I cannot get the treatment for them, but I can help them to go through the treatment and make it well tolerated, something that can be done. You have a doctor that actually wants to help you, somebody who actually wants to be here and help you to treat your cancer. That's important.